Joining us right now in an ABC News exclusive, Admiral Brett Giroir, the Assistant Secretary for HHS and, of course, the White House Testing Coordinator. Admiral, thank you so much for joining us this morning. I want to jump right in because there's a lot of confusion out there right now. I'm hoping you can help clear some of this up. We saw that remarkable contradiction this week. The CDC director there on Capitol Hill says vaccines will not be widely available until possibly the summer. The president says he's wrong. You were there. Was Dr. Redfield wrong?
So thank you for having me on, and I actually think Dr. Fauci explained it very well last night. The CDC director was correct that widespread use of a vaccine, hundreds of millions of people, will probably not happen until mid-next year. But the point that I want to emphasize is we could immunize 5 or 10% of the population and get 90% of the benefit by ring fencing the vulnerable, like in nursing homes, or vaccinating our teachers or those who have hypertension. So both are correct. If we had a vaccine, even a few million in November, it could make an enormous impact on the health of the country. But it is also true that everyone who wants a vaccine may not be able to get it till mid next year. So I really do think both are true. And Dr. Fauci, I think, explained it real well last night.
Okay, you're on the task force. I want to ask you about this former member of the task force who came forward to say that the president's response to the pandemic has shown what she called a flat-out disregard for human life. Can you say right now that politics is not part of the decision-making that is happening on this task force?
I can definitely say that. And Ms. Troy was not a member of the task force. She was a staffer to the vice president. We work with her very frequently, gathering materials for the task force, et cetera. She never said a negative word about the task force, the operations, anything in that regard, even though she had the opportunity. I can definitively say that the task force meetings are evidence and science-based. They're almost geeky in the way they're conducted, with Dr. Birx going through all the data, then Dr. Fauci. It's clearly a science-based, evidence-based process. And I never saw the president rant and rave in a task force meeting. I was not there in February and early March. I joined in middle of March, but the task force meetings are very regimented, very evidence-based, with the scientists leading.
Let's talk about these, the revised CDC guidelines that recommended against testing if you do not have symptoms. We're learning this morning that you orchestrated the edits of these guidelines and that they were put out against the objections of scientists at the CDC. So why put out guidelines that your own researchers objected to?
So there are about 4 misstatements in what you just asked in that question. Number one, they were CDC guidelines. They were generated by the CDC. They were posted by the CDC. Number two, it never recommended against testing those who are asymptomatic. In fact, there were specific recommendations to test asymptomatic in outbreak areas, and we have taken enormous actions, like I issued a PrEP Act guidance giving liability protection to test asymptomatic individuals. What they said was, if you're asymptomatic after exposure, you should do it within the context of public health or medical advice. And I think that makes total sense, but you'll see even more clarifications of that today. The third thing is it absolutely came from the CDC. There are thousands of people at the CDC. I have no idea who the New York Times talked to, but I know for a fact that the version that went to the task force was reviewed and approved by Dr. Redfield. It was reviewed and approved by the senior scientist who was the incident manager, and in multiple emails to me said that the pertinent issues were reviewed by subject matter experts. This was not posted on the CDC website. This was a CDC document, and we will continue to clarify, because I want people to know that if you are asymptomatic, you can still spread the virus. That's why masks are so important. And we want to encourage asymptomatic people to be tested. You'll see more clarifications about that coming out probably today.
Dr. Giroir, thank you so much.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.